Hello, everyone. It's a pleasure for me to be here today and actually to share our company's vision about health brands till 2030. My name is Rado. You can call me Rado, and I'm Bulgarian, originally from Bulgaria. I spent 2 years here in Croatia right before the pandemic, establishing and helping our team here to really to grow our business. Now I'm responsible for our communication business in Romania, so hopefully today I can share more insights about healthcare trends across our region, Southeast Europe, till 2030. Hopefully I can manage to manage. No? Sorry. Yep. Last week I was on my routine exam with my doctor, and actually they asked me how old I am, and based on some data they told me that I'm 34 years old. Absolutely not true. And I'm 41 years old individual who actually realized pretty much 2 years ago, I think, right before turning 40, that health is very personal and very important, and actually that's the most important asset that I have. So I need to be to invest more time and efforts actually to take care about myself, and that's why actually I have this Apple Watch since then, trying to really to make sure that okay, I'm doing some stuff, good stuff for me. As you can see from the data here, not impressive at all, but I have excuse. Each and every month I'm traveling a lot, so I have more air miles than steps. And based on this data, actually, I'm trying really to build my routine in a way that will help me. And I'm sure, because I'm sharing this personal example, to prepare you that we'll talk about data a bit later, how consumers are sharing their data with some companies in order to receive really some benefits from that. And as I said, I'm coming from dentsu. Dentsu is one of the oldest marketing companies in the world. It's coming originally from Japan. It's more than 120 years old, so you can imagine all the things that they invented there, and now they spread across the world. And we at dentsu actually are obsessed with consumers. And yes, we do a lot of research on a daily basis, globally and locally, including here in Croatia, because we really want to understand consumers and their behavior, their lifestyle, why they act in that way, why they live in that way, and how actually they make a decision to choose this brand or that brand. So today, actually, I'm going to share a couple of insights and results from some of our studies that we conducted latest in the past 3-4 months globally, but also locally here in Croatia. And we'll analyze the trend in healthcare towards 2030. And actually, it's not so far away from today. It's only less than 7 years. So actually, we need to be prepared what's behind the corner there. As I said, we are obsessed with data, and we have one of the biggest in our network consumer study. It's called Consumer Connection Study, or CCS in short. We are asking individuals across each and every market where dentsu is present. Each and every year in Croatia, actually, we are asking more than 2,000 individuals each and every year about their behavior. And based on this data, for Croatia, actually, we grouped here 6 consumer groups. And you can see in this line they are positioned pretty much on the same level, but these groups are very medicine and doctor-oriented. Some of them are naturalists, so more oriented to these global megatrends that we, I'm sure, all experienced in the past years. So Which one of these you think is the biggest one? Maybe because of the pandemic that hits the whole world in the past 3 years. Maybe you think it's the health managers who are the biggest group here in Croatia, or maybe because of the inflation that hits not just Croatia but pretty much Europe. Maybe you think it's those who are cost conscious, or because, as I said, this mega trend of being more close to the nature. It's the naturalists. Actually, this is the result. The group who is the biggest one here, it's so-called health managers. They are the fastest growing group here in Croatia. And why is that? Because actually they are quite prepared. They have quite a stock of medicine at home, but they are not scared to buy more and more each and every day. And yes, it's true that all groups here grows from the past 4 years. But the slowest growing group is this doctor-oriented. And it's interesting that the health managers has grown 25% in the past 4 years, if we compare the data this year with the data 4 years ago. And probably there is a reason behind that, for sure, because self-care and skincare, by the way, I'll talk about skincare more in detail soon, is it's emerging like global phenomenon. It's not a trend that is happening only here. It's global phenomenon. And this same trend actually is observed on a global level, no matter if we're talking about Europe, Asia, or America. Why I said Asia? Because actually the majority of the newest thing coming in pretty much each and every industry, but we observe this as communication experts. If we're talking about self-care or skincare, it's coming from South Korea. And not only that, all these new social media applications, okay, TikTok, probably not the most popular one right now here, but it's growing globally, and they hit everyone earlier this year with one AI created filter, skin filter, who actually, it's so realistic that really scare a lot of people. So this is also part of this trend, and you can see here data starting from 2004 to this spring. This is Google search data. So you can see that self-care, especially the skincare focus, is exploring right after the pandemic. And based on one of our global studies that our colleagues from Dentsu Global conducted recently, I extracted some data points here to put extra focus and attention on them. And you can see here a couple of digital channels, starting first with search, online patient community, social media, websites. Let's focus on each one of them. Why? Because it's important to see what actually people from different generations do nowadays. How can we capture people's attention through media and communication? Probably that's the most important question. There is no difference among the different generations for search. Search is the first engine for them to go and check and ask. When we say search, usually we think or we talk about Google search. Actually, the second biggest search engine in the world is YouTube. So people are searching for their skincare or healthcare questions. Again, they expect to find the answer, as we all know, probably in the first 3 organic search results. again, not only in Google, but remember, YouTube. So your answer not necessarily need to be in words, but as we see how the new generation communicate or perceive media, probably video is a good approach here. As you can see, these online communities are still very popular. I know I'm not part of them, but I know there are many of them in Facebook. There are closed group where people or different patients, they're sharing different opinions there. Social media, obviously, it's super important, especially still for millennials. And your website, this is something that it's still here. It's still bringing people's attention, consumers' attention. And once, actually, when you attracted consumers' attention to your website, what we should do there, how to engage with them. One obviously effective method is to ask for their personal email address and to start sending at least newspapers. So this actually brings us to this new era of data paradigm. Because, as I said earlier, we are consumer and human obsessed to know what's going on in their mind, and we are trying to understand their behavior. People are contradictory in their behavior. Everyone probably will say that, yes, they care about their private data and they are absolutely not okay to share their data with companies. There are some people who actually use ad blockers and, for example, private mode of browsers, really not to share their behavior with some companies. On the other hand, people are open to share some data, including personal data, including DNA samples, if they receive some valuable benefit from this company or from this brand. So personalized messaging or personalized meeting between consumer and brand, it's important, but the brand need to be very open why they are asking for this data and actually how they are using this data and what kind of value exchange they are giving in exchange for this data. As a warm-up here, I share some human examples, but now actually how human we truly are and will be in future. There are a couple of big discussions right now. You probably heard about artificial intelligence, how scary this is and how this will affect us eventually. So this example here on the picture is from exoskeleton. It's already used somewhere across the world. So actually our study reveals that by 2030, securing long-term health, extending longevity will be actually the ultimate goal for each one of us. Believe it or not, thinking about it or not. And power with new tools, new technology for data collection actually, like for example this Aura ring here, we can share our personal data. And Apple Watch as well. Yes, it's true that I am sharing my personal data. Maybe I consider that this data is not so important for me, but probably it's important for the company who is using it to give me back better user experience. This ring, for example, probably you heard that they used the ring during the pandemic, sharing data and in an anonymous, of course, way. And the data show that almost 2.5 days before and 10 days after COVID, the ring can register some symptoms. So it's useful. So this wearable technology and all these tools that are coming in our daily life and routine, actually, they are helping and will help the health brands in future. When looking to 2030, again, biohacking is set to become more relevant. Third of the people, 32% actually, would be willing to, for example, to having non-essential surgery for their mental health. Another third, 34% actually of the people, are considering to have this microchip or brain surgery to improve their physical lifestyle, life expectancy, even to learn new skills. And yes, maybe it sounds scary, but this is another surprising effect from our study, the idea of robots or artificial intelligence in our life. Yes, people expect this to help them, to improve their life being and wellness. And yes, maybe in future we'll have robots taking care for our elderly, improving their daily routine and their lifestyle. Something that is also happening here is, of course, the rise of wellness as a service. Well-being, wellness as a service. You can see and experience this in many brands communication nowadays. So consumers are willing to dedicate a big chunk of their personal data to one single company, and actually to bring this company in their life. Let me give you an example. Actually, three. Two of these companies are US companies. One is Alibaba, is from China. All of them are so-called Titan brands. So they're masters in their field. They're the biggest probably in their game, like e-commerce, content, connectiveness, technology. But actually, all of them now are playing in another field, in healthcare. Let me give you an example with Amazon. Probably you heard that they launched their virtual clinic with doctors and even their own white label pharmacy brand. So you can buy it, or you can apply and pay monthly fee around $5, which is around 4.5 euros. And you can pick and choose from around 80 drugs that are for common disease like high blood pressure. It's the same happening with Alibaba, but in China. Apple. Yeah, this example here is from Apple. And this is an application built by them. It's for hospitals, by the way, but it's used with, from patient as well, for patient management. So yes, it's true that, just imagine the patient can check the results from their exam. They can check their next exam, or they can order the food, or order an extra blanket to their room at the hospital. It's there. It's already here. And all these Titan brands are using our personal data in order to improve our well-being. And people are open to share their very private data. So being effective with our communication means that we don't need to only deliver the brilliant facts, brilliant basics for our products. We need to address consumers' needs directly to them. It's like direct communication, their needs. And I started today's session talking about the importance of understanding humans. And the reason is simple. What consumers think, say, and do, actually, is affecting your brand. How relevant your brand and the communication is for the people. Let's say I'm using a vitamin water brand each and every day. I have a membership card. So next time when I'm going to pick and choose water brand, obviously, I will pick and choose this one because I expect some benefit. So let's be honest, I am not sharing very sensitive private data that I prefer this water brand, but in exchange of this data, I expect some benefit from this brand. As we go into details of our consumer behavior and their consumer changes in the past years, it's really essential to understand the personalization and the effect of this personalization to different groups of people. And yes, it's true that here the sex also has effect in should have effect in our ways of communication, because, for example, for women identifying individuals, how they act and how they perceive and receive communication from healthy brands. Actually, they have a very clear routine. They know what they're doing. They have a very clear path who they follow each and every day. So for brands, it's actually very hard to break into their routine. But some brands are doing this using influencers, some samples, really to go into the women's routine and to show them the benefits of their brand and product. With male identifying individuals, the situation is totally different. And it's true that actually they rely more of recommendations from their communities or from their very, very close friends. So here it's more about education to go into their routine, more about highlighting the convenience of use of this or that product. So, differentiating yourself in this highly regulated industry, like, for example, pharmaceuticals, it's crucial. It's not the only one. We can learn from other industries like finance, what and how they are doing this, but it's crucial. And of course, in this regulated area, actually, majority of the pharma brands are swimming in this sea of sameness. So how we can be different, how we should communicate different. Okay, go and use some small tricks or techniques from other industries. Not necessarily close to our own industry. See what the other industries are doing, how they are communicating their products and brands and benefits with the audience, with the consumers, because pretty much consumers are the same or similar. Try to take something and reuse it in your own communication. Data, again, but I know that when GDPR came, we, as marketeers, were stressed at the beginning. We didn't know what to expect, how to change the way how we collect data, how we communicate, in order first to be protected, second to protect our brands. But data is something that is here and will stay. And yes, we will continue collecting data. The question here is what we are doing with this data, how we are collecting this data, and we need to be very clear communicating with our customers that, yes, we are collecting your personal data, we are using it for this and that, and actually you receive a clear benefit in form of anything. Another trend is the trend of this tech-enabled well-being, and it's on the rise, let's be honest. And brands that really make technology accessible will be rewarded by consumers. By embracing really technology, that means that we understand better consumers and how they use the technology in their life routine. And to go beyond medication, it's another very important trend that we need to think about, at least if we want to change the way how we approach the customers till 2030, is brands should really prioritize the development of some comprehensive treatment programs. It's not about the pill only. It's about the whole story behind the pill. You need to have this personal touch with each and every consumer. And here the last point, and probably from my point of view, the most important is empathy. Empathy is visible in many company and brands communication nowadays. And even in the health industry, empathy actually emerges one of the superpowers. We see examples like companies are introducing chief patient officers really to take care and to put the customer at the center of everything that they do. To change the way how they operate internally, how they communicate with the patients in personalized way, in empathetic way. So, at the end, it was short, but now hope you have more questions in our Q&A session. There are just probably 3 things that I really want to highlight here. The first, yes, data, but respect privacy. Offer value exchange, always. And be empathetic as a company in your daily routine, in your internal ways of communication, in your ways how you engage with customers. Thanks a lot. You can connect with me using this barcode. Thanks.
Okay. So, thank you for this amazing presentation. I'm pretty astounded by the amount of data you collected. So, data is important. You emphasized that a lot during the presentation. And the one thing that struck me, and I would like to start with that, is people are almost equally anxious about their privacy. Mm-hmm. They don't want to share. And yet we can almost easily coerce them to give us some data. Is there any difference between the data we're anxious about and the data we're sharing? And what are implications for the brands? So is it just, okay, I'll give you a discount and you give me your email, or is it something deeper?
Great question, and I think from my personal point of view, it's about the trust and the connection between the customer with the brand. I can share my personal experience. Yes, I am willing to share my personal data, even my private health data, with a company or brand who I trust and who I know that they're bringing me back some value for exchanging this data. Yes, I know that it sounds stupid, but I really need to improve my health routine, and I'm openly sharing this data with this company. And in exchange for that, actually, I'm receiving a lot of push notifications, some analysis that help me to understand better my condition at that period, or to motivate me actually to do more in the next. So it's all about the trust. So if I, as a customer, I don't have the trust with this company or this brand, absolutely I am not going to do anything with the brand. Probably I'll use it, but I'm not going to share any private data.
I think the anxiety part stems from the not knowing where your data will be used. For example, we talked before your presentation how we both hate when our smartwatches start yelling that we should move or drink water or something. But maybe I would be anxious equally knowing that, I don't know, my employer knows about my health stats, or my insurance company. There's a lot of implications around that.
True, and this is again a good example, because yes, I'm absolutely okay. Yes, sometimes I'm frustrated when someone is using my own data against myself, because actually they're pushing me to do more. But actually, I perceive this as a health care for myself. So this brand, this company, through this service,
kind of takes care of you.
Exactly.
Okay.
And yeah, if the employer care about myself, probably I will expect them to send me a notification for my next medical exam. Probably it's happening, probably some companies not, but again, it's about what is the outcome, what's the benefit that you receive from sharing your personal data.
There is one interesting data point from the beginning of your presentation. I pretty much like those 6 attitude groups.
Yeah.
The one thing that concerns me is that the doctor-oriented part showed the slowest growth in the last 4 years, during which we had 3 years of pandemic, where we basically relied on healthcare professionals. We finally understood their importance. Why the lag? Is that the trust issue? We talked a lot in this forum about trust.
I don't think there is one single person, not just here in the room, but globally, who can say exactly what happened in the past 3 years.
Okay.
Yes, there are some people who count 100% of the professionals and experts during the pandemic. There were people who are saying no to everything. There are people who actually started caring about themselves, their family by themselves. Reading different articles, watching different videos, opinions. I don't know what happened. Nobody knows actually what happened and what influenced this difference in people's behavior. But what we can see actually is the fastest growing group is of those who are exactly, the people who,
which is not kind of the behavior we want. You don't want people self-medicating. You want them seeking professional advice.
Yeah, but maybe these are the people between the most extreme one who are saying no to everything, and the people who actually count 100% of the professionals. So sitting in the middle, you are choosing to pick and choose whatever you believe is good for you and for your relatives.
Okay, I'm picking your brain now since you're here and you have all this data. I really want to know. Where is Croatia in EU average in health attitudes? Are we in the middle, on average? Are we more doctor-oriented, less doctor-oriented?
Based on the data, actually, the people here now are more doctor-oriented, but it's not like exception. At least from what I can say from the regional point of view across Southeast Europe, it's pretty much the same trend. So it's not like exception here. And I think it's, without having the clear data points now to confirm, but I think it's pretty much the same or similar behavior across the people in the southern part of Europe in general.
So I would just assume that Nordics are maybe more prevention focused. I kind of perceive this region as being as such.
True, but I mean, it's not about people's behavior. It's about the attitude. It's about the way how the government and how they really constructed their system. So if you start from the very beginning having this behavior, obviously you will follow this behavior.
I'm asking you because I would like maybe to find some areas where brands can work to boost exactly such a behavior, because it leads to prevention and it's less healthcare costs.
I think it's good for each and every brand really to reconnect with customers on a personal level. So it's always a good idea to invite your customers or consumers to meet some professional from your company or some specialist, and then to have this direct conversation with them. And in that way, actually, the person, the doctor or the professional can share personalized examples or advice with each and every one from the group, from the people. One-to-one communication is better for them really to understand that, okay, one pill with the same name probably is not going to have the same effect across 10 different individuals. So this personalized communication, it's important if, for example, we want to change this trend and this behavior of being our own health managers.
Okay, we talked a lot about innovation. There's a lot of disruption here.
Yeah.
Amazon, okay, and Alibaba, I see a question here, so I'll reframe it with the other questions that I have on that subject. They're not going to come to Europe anytime soon because we would have to change our legislation to allow it. But my question would be, healthcare is very heavily regulated. I don't think there is any more regulated industry in the world. And that regulation is making it very cautious. And all these innovations and all these new innovative tech-led, data-led approaches are pretty in opposition to that. How do we connect those two approaches? How do we take the best of innovation and technology and the best of that caution, because it really has served well?
Great question. I'm maybe it's wrong to say as communicator, but I'm a big fan of regulations. I think we share the same opinion here. And I personally think it's a good thing when you have a framework, and then within this clear framework, you can be as creative as possible. And here the magic happens, because if you don't have a framework, I mean, we don't know what can happen. So yeah, I'm a fan of the regulations. I don't think that, for example, this Aura ring that I shared here, is something that go beyond the regulations. It's something that probably will help us as a professionals and probably the people or the consumers later, really to connect even closer the companies with the customers. Because again, it's about trust and about connection. If I have this ring or this technology or in any other device, or even Google, they also introduced headphones who are tracking and sharing your personal health data. So if I have this trust, and if the company is using the technology in order really to give me back some value, and it's again regulated the way how they use this data, I'm okay.
But there is a big if.
Yeah.
If you have the trust. So
it's all about the trust. Yeah.
Okay. But maybe the tools, the tactics, the channels we are using now in healthcare sector, and I'm speaking broadly now, maybe they are not fit for the present circumstances or the present society.
Agree and disagree, because I'll give you an example. Nowadays, maybe you can create your display communication for your next brand campaign using AI tools who can automatically generate probably hundreds of different creatives linked to specific KPI or objective from your brief. So yes, this technology can be used in a good way, again, in this regulated framework. But when we talk about AI, like, okay, Chat GPT, probably it's a good example because it's a big discussion right now on a global level, locally as well, within our teams on a daily basis. The first and the most important thing probably, again, it's about trust, how we should trust that these tools not using the data that we share with them in a way that they can use it in generating other answers of somewhere across the other part of the world against us, let's say it that way, or how we are sharing private information. Okay, we are agency people, we work with clients. If we start using, for example, Chat GPT, asking, hey, could you please write me an answer of this client's brief? Actually, obviously, we need to share the client's brief detail there. So we actually are sharing private information. So till the moment that me personally, I don't have the reassurance that I can use these tools or technologies in a way that it's protecting my client's data, my personal data, I'll be more careful.
Okay, we talked before the presentation about good examples of reclaiming space, reinventing it yourself, and using technology, using innovation to reposition yourself. So there is a good question. What's the key element that brands in our industry can use to stay relevant in today's market? And I would really like you to share the example you shared with me.
Exactly. I mean, it's coming from another industry, and from my personal point of view, as customers, not as professionals, take it like I'm a user of these brands. After probably iPhone invention, the second biggest thing that happened in my life and changed my way of living is actually the invention of IQOS from Philip Morris. And we know that the tobacco industry in the past, I mean, are not the industrial companies are not with the best reputation in the world. They actually pretty much are against, right, the people's health. That's the general feeling of all consumers in the past. Yes, they took the challenge. They invested a lot of research, data, technology, and they invented totally new products. And nowadays, actually, they're repositioning themselves. And I don't know, it's interesting, but nowadays, their users or customers, they are pretty much like they are brand ambassadors. So they completely shifted this behavior.
What's very important for me is that they rebranded their customers. So you're not, you know, smoker, you don't smell, you're using IQOS, so you're okay. You can basically smoke anywhere.
Yeah, this is just another device.
Yes.
So they exit from this old habits, bad area, and they put their product as a device. They position themselves as a device, and we like different devices. So we're a big fan of devices.
Yes.
And now, even their B2Me, business to me connection with customers is different. Nowadays, for example, on the airport in Warsaw, they have a big place. It's not a store. Obviously, you can buy products. I'm talking about like a big ambassador for them. But actually, instead of sitting somewhere at the airport and waiting for your flight, you can go there, you can sit, you can drink coffee. There is always a person who can offer you something extra, like free coffee, really, magazine. And it's very comfortable.
It's experience.
It's experience. And this is personal business to me experience. That's exactly the point that we talk about.
What would be your takeaway from that? What is that key ingredient that they used to stay relevant, to become even more relevant than they were?
Probably probably they realized that as a product, as image, as perception, it's not what they want to bring with them in 21st century. So they checked the future. They saw that actually technology is something that can bring a lot of benefits. They listened to the consumers and the customers in a way that, okay, the smell, we all know, it's not good for our health. Okay, let's try to reduce this element and that element. And they actually invented exactly that.
Okay, thank you. Our moderator is here to cut us because we would probably be talking for an hour. Big applause for Rado.